MGMA has long advocated for reducing administrative burden and routinely surveys our members on administrative hurdles they face. In our 2026 survey with over 230 respondent physician practices, more than half of the practices report losing a physician to burnout in the past 3 years. We spend a lot of time telling doctors, you're in charge. You're the quarterback of care. We actually increased the E&M codes, but every step of the way, we question what they do. MGMA was offered a seat at the table. And I think that's what's important to remember is that our strength in Washington allowed us to be invited to sit and testify in front of this committee. I was just so thrilled and honored and a little bit scared to be offered that opportunity.
Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We're back today with another MGMA Insights Podcast, and I'm really excited to bring our guest on today. Today, joining us is Jeff Smith. He's the CEO of Piedmont Healthcare. He is also MGMA's incoming board chair, and it's really exciting to get to spend some time with Jeff today. And I'm going to bring up one more thing that we're going to be talking about. Jeff recently testified before the U.S. Senate Special Committee on Aging. And I've got questions for Jeff about that, what that's like to be testifying before Congress. So, Jeff, I just want to welcome you to the show.
Thanks, Daniel. I greatly appreciate the opportunity to talk with you and to share my thoughts on MGMA. So I look forward to our discussion today.
That is wonderful. Now, you were telling me offline that you are, I believe, just north of Charlotte, North Carolina. So we're excited to come over to your area. We're going to have our MGMA Operations Conference coming up in April. And so a lot of us are going to be there and hope to get to meet you in person when we're in that Charlotte area.
Yeah, that'd be great. If you haven't registered, please do so. It's a great conference. Our spring conferences have been going very well. So we certainly look forward to everybody coming to the Charlotte market, experience a little Southern charm and some barbecue.
That is wonderful. I have to agree. I've been to Charlotte once that I know of. I actually came there about 20 years ago for a job interview. The Sports Business Journal is headquartered there, and I was one of 2 finalists, didn't get it, but it was one of those sliding door moments because I met my future wife about a week later, so that would not have happened. So things work out, but we did have some amazing barbecue when we were there. So I do want to congratulate you. You are, as I mentioned, the incoming MGMA board chair. If you don't mind just sharing with us your thoughts on that, being the incoming board chair, and some initial thoughts you have about your role as incoming board chair.
Yeah, absolutely. First and foremost, it's an incredible honor. I've worked in the physician side of healthcare for too many years to mention. But to me, that MGMA is really the association that really handles and it's our voice in Washington. It's our data. It's our community as we go to conferences. So to sit in a position of board chair, I'm really overwhelmed. But I will tell you that it's actually my second stint. I was board chair from 2022 until 2024 as we came out of COVID. So I may be the only person who will serve 3 years as board chair. And I know some of you are probably thinking, oh my gosh, can't we find anybody else? But again, MGMA obviously is in a transition phase. The board thought it was very important that we maintain some stability. But even with that, honored that they asked me to return to the role. And I look forward to that.
Yes. And as you mentioned, it is a monumental time as well for MGMA. We are going to be celebrating our 100th anniversary. We're going to really kick that off at our fall conference in San Antonio. You're going to be brought in as that board chair at that moment. So that is going to be exciting. As you're preparing for all of this, just from even 30,000 feet? Are there some just big picture ideas that you want to really focus in on as board chair once you're in place there?
Absolutely. I hope the membership is already hearing this. We want not just the 100th anniversary, but we want MGMA to refocus on the members. We really have to get back out there and give people a reason to give us their money for membership. I think in the past we've distanced ourselves from the membership, not intentionally, but I think that now we need to reconnect. We need to get out there and shake hands and kiss some babies and say thank you. Thank you for being a member. What else can we do for you? And I hope that that the membership will come, whether it's to a spring conference or to the annual meeting, and really see that warmth come back. All the things that are important, whether it's celebrating fellowship, certification, all the folks who volunteer, and just being a member, and the value that you get for being a member. We need to celebrate and refocus on that, and make people understand and get excited again about coming to our meetings. So that if we can accomplish that through my term, I will be thrilled.
I totally agree with you. And we talk about that internally as MGMA employees, that let's really turn this lens to the members themselves. So all of you who are listening, that is where our dedication and focus is, whether it's from Jeff's side of the aisle or if it's from people like myself who do a podcast or a webinar. We want to put y'all at center stage here. And so if you don't feel like we're doing that, let us know. Send a letter to Jeff, send a letter to me, call us, let us know and see what we can do.
Absolutely. And I'm one of you.
Yeah,
exactly. I work in this every day. So please let us know. I came to the board from the Data Solutions Committee, the group that does the surveys. So I've seen the underbelly. But MGMA is such a great group. When I switched from the hospital side to the physician side, this was the group that I thought, this is what I need to be a part of. So let us know how we're doing.
Yeah.
We want to hear from you, and we will listen.
Absolutely. All right, Jeff. Well, some other people have been listening to you, and this is the U.S. Senate Special Committee on Aging. I made a joke about it earlier because I don't know if it's like jury duty where you just get a letter in the mail and suddenly you're in D.C. testifying. I joke a little bit about that, but tell us about this surreal experience of testifying.
Well, that's a great way to describe it. And I think MGMA was offered a seat at the table. And I think that's what's important to remember, is that our strength in Washington allowed us to be invited to sit and testify in front of this committee. As a result, they went out and they said, okay, who can represent membership? Is it somebody from a big health system? Is it somebody from a large independent, a small independent? So we kind of went with the sweet spot and said, all right, let's get a large independent in Piedmont, 230 providers, $250 million company. So they thought, okay, that represents what doesn't represent the super large and doesn't represent the super small, but can really speak to the challenges that hopefully all of us are facing. So I was fortunate enough to be asked to be that representative. Anders, who handles the Washington office and all of our advocacy work, gave me a call, and it's kind of like winning the game show, right? It's like you want me to do what? I was just so thrilled and honored and a little bit scared to be offered that opportunity. So I had to go buy a suit. We work in an industry anymore that really doesn't get dressed up every day. So I said, hey, what's the attire? Should I go kind of casual? And they're like, well, he's just a regular guy, and they're like, you better wear a suit. I'm like, okay. So off I went and bought a suit. So, but yeah. Great experience.
That is incredible. What I picture, and maybe you said a little bit of fear going into it, we've all seen these clips that they show on TV or either as documented in movies where they're basically slamming a gavel and screaming at the person. And I don't know, maybe this particular topic didn't get there, but you tell us, what was the mood like? What was the tone in which they engaged with you?
So it was very interesting. Senator Scott got there a little bit early. Senator Gillibrand got there a little bit early and actually came down and spoke. There were four of us that testified. So they shook our hands. They thanked us for our time. They realized that, we were volunteering, taking time out of our day to come and talk to them and hopefully educate them. They kind of set us at ease. They said, look, just talk to us. And what you don't know is that beforehand, we had to speak to both the Republican and Democrat side. So we had meetings with their aides. They went through our paper. You have to submit a paper, which is the long version of your testimony, and I guess just to see what you're going to talk about. They asked some questions, and both sides got that opportunity. And then they had the opportunity to submit questions. Now, we didn't get a lot of questions, so a lot of them we weren't aware of what they were going to ask. So you kind of had a feeling going in that this was a bipartisan issue. Everybody was trying to come up with an answer on how do we deal with physician burnout, the loss of physicians. They kind of set you at ease before, but then you sit down and there's a box in front of you with a timer on it and a microphone. You got to push a button, and it's like, holy smokes! The fellow sitting next to me said, "Have you ever testified before?" I said, "No." He said, "I'm going to give you a piece of advice." I said, "Oh, great." He said, "Don't drink the water." I'm like, it's in a bottle. He said, "I don't know how long this is going to last, but you can't leave, so don't drink the water." I'm like, all right, great advice. Thank you.
This really sets the stage for what was being talked about. So it is a special committee on aging. You're brought in representing MGMA, representing all those MGMA members, all those practices out there. What was the main message you wanted to get across to that committee that you were testifying before?
Their main focus was burnout. And we've all read that, in 10 years, we're going to have a shortage of about 170,000 doctors. And what can we do to change that? What are things that are driving physicians out of practice? So we talked about prior authorizations. So that's the current docs. We talked about the people going into medical school, and why aren't they going into primary care, internal medicine, family medicine. But I think the message that I wanted to convey was we can change things. We can change the burden of prior authorizations. We have to start respecting physicians. We call them the quarterbacks of care. We've increased the amount of money that we give to them, yet every step of the way we question what they do. And I think that's what has to change. We have to understand that most of them are not looking to game the system. They are looking to take care of their patients in the way that they feel is appropriate. We can't treat them like we're all trying to get over on the system. So I think if we do that, and we have so much data to help us do that, let's start utilizing it. And if we do that, I think doctors' job satisfaction will start to go up. And we've seen that the burnout numbers decrease slightly, but it's nowhere near enough. And we still have significant problems with doctors leaving practice.
Right. Now, you've had a lot of experience on the administrative side at Piedmont, but you also brought in some other personal side on the clinical side. Your wife, with her career in nursing, now you have a daughter practicing primary care. So you were able to share some real life experiences and also your better understanding of what it's like for those clinicians. Tell us about that.
Yeah, I'm very fortunate. My wife was a clinical nurse for 20 years, worked med-surg, worked ER orthopedics, and then transitioned and worked in the clinical research world for the balance of her career. My daughter is a primary care doctor. She has a good family medicine practice, and in total transparency, she works here at Piedmont.
Wow.
So she's an owner of the practice, which makes it a little weird because she's actually my boss. So imagine how those Thanksgiving dinner conversations go. Um, but what it provides me is the clinical side. I mean, my background, I'm an accountant. So I get the bean counter jokes, and you don't know anything about medicine, but I have them grounding me in that world. That they help me understand what truly happens in the practice, what their staff is facing. Because there's one thing that we need to understand: physicians don't corner the market on burnout. The front desk folks, and I will say this to anybody who will listen, they have the hardest job in this practice. That includes doctors, includes me. I mean, here are folks probably, most of them don't have more than a high school education, and that's fine. But we ask them to be insurance experts and psychiatrists and best friends. And, it is such a challenging position, and turnover rates in healthcare are huge. So I get that insight from my daughter to really help me be a better administrator of the practice. So it's challenging at times, but I'm very fortunate.
Yeah. You made me laugh so much because when you said your daughter's now your boss, and I was thinking, I have a 21-year-old and she's my boss too, and we don't even work at the same place. But I totally get it. Anybody that has a daughter, But I did want to ask: do y'all have guidelines, boundaries, guardrails in your family where you don't talk about it, or you just say, hey, we're going to keep the gloves on and be kind and just express a few things? How do y'all navigate that?
Yeah, it gets challenging at times. Look, there's a lot of pressure, and it's a unique situation where she gets to sit at the table and say, "Dad, I need to talk about this." And I've had a conversation when I would say, "Hey, look, you wouldn't talk to the CEO of a company like that.
Right.
That's the role I'm in. So let's kind of keep those boundaries in place." And look, she's a great kid. She has a great practice. She's an incredible doctor, and she's passionate. So I appreciate that. I mean, she's no different than anyone else who works here, but we do try. We do try to keep the holidays as sacred ground,
right,
and limit those conversations.
For sure. When you shared this information on burnout with the committee, how did they receive it? What is that give and take like? What was it like for you?
Yeah, that's a great question. There was a lot of head nodding when we talked about it. Yeah. And I don't know how many folks listened to the whole meeting. There was a woman there who spoke from the medical school standpoint. There was a fellow there who spoke from the concierge medicine standpoint. And to me, that's somebody who's already bailed on the system. They've kind of said, look, I'm out. And then there was a fellow who has a foundation who wants to raise money, keep raising money, as his sister was a doctor and committed suicide due to burnout. So 4 very different points of view.
Right.
I appreciate them trying to come at this from all different angles. I think they listen. But what's concerning is you look at what's happening in Washington. We have the Wiser bill right now that is being trialed. That's just putting more prior authorizations in place. So I think what they have to do is really take a step back and go, are we really headed in the right direction, even with current legislation?
Mm-hmm.
And hopefully what they heard was, maybe we're not.
Right.
We need to rethink this and really start to back off a little bit on some of the things that we're doing. I hope so. After the testimony and the cameras were turned off, they all came back around and said, we really appreciate you being here. We appreciate what you said. And, with 100 senators, it's always tough. They're incredibly busy. I hope it makes a difference. I know that our folks in Washington with the MGMA are hammering these points. I mean, they do listen.
Right.
So please, if they ask you to write a letter or testify or do something, participate. It's our chance to really do, make our feelings heard. I think it was good. It was good to get in front of them, and now we'll see what happens. And just I've been fortunate enough. A couple of years ago, I went and met with the Surgeon General and the head of Medicare Medicaid
Okay.
about prior authorizations, and we did see some change. So I think it is possible that what we do and say makes a big difference in Washington.
Right. I wanted to ask you that question because about 20 years ago, as a journalist, I followed the financial services industry as they sort of marched on Capitol Hill and they spoke. And I was there as a reporter taking notes, but I could tell a lot of the information that was being shared, it was just a glazed over. They had no idea what they were talking about. Now, in your case, at least when you're talking about burnout, that's so universal as people, particularly in healthcare, but just as people, we're getting ground down, so to speak, in many, many industries, not just in healthcare. So perhaps there was an opportunity to connect there, but you also talked about MIPS and the quality payment program. I'm not sure if there was a glazing over in certain instances, but tell us how did that go over when you did talk about those issues and those programs?
I would say they were listening. I'm not sure they were understanding.
Right, right.
I mean, it's a complicated system that some of us in the field aren't really sure what the best steps are. So I think fortunately they have a lot of people that work for them. Every senator had 3, 4, 5 aides working behind them. I hope that those are the ones that read the paper in depth,
Mm-hmm.
that told the senator, look, here are the things we really need to focus on based on what we're hearing. You're right. As we talked about burnout, a lot of head nodding, but when we got into the details,
Right.
not the same response. So I think it's going to take a lot of time and a lot of effort on their part to really understand what it is we're going through as a result of the programs that they've put in place. I like to say it's who moved my cheese, because the industry, as we figure it out, they go, oh, they're getting good at this, let's do something else. And because they don't want to pay us too much money, so let's make it harder, or let's change a measure that we're looking at. And I think we have to stop doing that and get to a point where the industry can be successful. And I know there's limited money. We can't fix every problem with money, but I think we can make it fair. And when you look at the hospital industry that gets an inflationary adjustment every year, and then when you look at the physician side of it where we don't, it's just not fair. So we need to really take a hard look at those payment triggers and figure out how we can move this forward. So we can all be successful, because hospitals are great, but they're bricks and mortar. Without doctors, you don't have hospitals. We've got to take care of the folks who are driving, this industry.
Yeah, you were mentioning the inadequate Medicare reimbursement. You brought it up when you testified. Talk about that operationally, the strain it presses there. And you also mentioned physician well-being, the strain it can cause there. What did you mean by that?
Yeah, so physician well-being, and I'll use my daughter as an example. I mean, it's a well-known, pajama time for doctors. They take their work home. They're finishing charts at home, some till 1, 2 in the morning, and then we expect them to be back in the office at 7:30, 8 o'clock, seeing patients, bright-eyed and bushy-tailed. It's just not realistic. And then compound that by the fact that we had the SGR problems for years, and sustainable growth rate and the laws that surrounded that. Finally, they were abolished, but we're still dealing with factors where we're not seeing increases in the Medicare program that come anywhere near inflation. We have to give employees, even though it's a cost of living adjustment of a couple percent, that's more than what the program is giving to physicians. And everybody follows the Medicare fee schedule. So it's a compounded problem that ultimately drives, especially in our world where we don't have, the operating rooms and the inpatient beds to drive additional dollars into our pockets to cover those shortcomings. So the physicians take less money home at the end of the year. That has to stop. And honestly, it's been going on for 20 years. So when you look at those factors, it doesn't take much to stop scratching your head going, gee, why is there burnout? So I have to see more patients. I'm on the hamster wheel, and I can only go so fast. And if you want me to see 20 patients a day, that's great. I can take care of them in a high quality way. But if I need to go to 30, 35 just to make the numbers work, and then we go, gee, why are all these independent practices selling out to the big health systems? They they can't manage the finances anymore. They don't have the adequate size. And you look at the solo practitioner, the 2, the 3, the 4 doctor practice, it just gets to be overwhelming. And even if the older doctors want to stay in that world, the new doctors don't. So once they hit retirement age, that practice is gone, and it's picked up by, whether it's hopefully an independent practice, but in most cases a big health system.
Yeah. You brought up the topic about consolidation. You are that incoming board chair for MGMA, so you're going to be thinking about these bigger issues about independent practices. How do we keep them viable in this state of consolidation?
Well, I'll go back to an earlier point. I think we have to make medicine fair. Most doctors do not go into this business for money, but you have to be paid a reasonable compensation to be able to pay your staff, earn a living, pay off your medical school debts. I mean, we have kids coming out of medical school with $200,000, $300,000, $400,000 of debt. How can they pay that off? Have a family, have a mortgage, and expect them to go, gee, I love my job. It's a difficult world. I think we need that fairness in medicine. So whether it's the MIPS program, whether it's just an annual increase, whatever it is, I think we need to make it look like something that makes sense to doctors. They can't be asked to just sit there and click a computer so we can gather data that we use for I don't know what. I mean, when you look at the MIPS measures, are they truly driving quality? I don't think so. I think we've set this up, and it's just a game of data collection. And I wish I could say it was great. And look, the quality is so much better, but I don't think it is. I think we need independent practices. I think there are kids coming out of training who have that entrepreneurial spirit, who want to run their own business and have a say in what goes on. I also think that there are people who are better at 9-to-5 employees and want to work in a health system. Both are perfectly fine, but we need both. I think we can provide high quality service at a lower cost. I think we're important to the health system. That needs to be recognized. I probably shouldn't say this, but I always say when we're negotiating with insurance companies, hey, look, I'll just sell the practice to a health system, and you can pay them a higher rate because I know their rates are higher than mine. That usually works. So there's your tip of the day. But it's true.
Yeah.
And it's a tough industry, but I just think if we're fair, I think we can keep this going for a long time.
Yeah. I want to ask you one more question then. If Congress could move on one reform from your testimony, what would you put at the top of that list?
Yeah, I read that question and I went, boy, that's a great question. I think it has to be, a reasonable pay update every year. I think if doctors could stop worrying about money, at least to a certain degree,
right,
then I think they could get, really focus on the practice of medicine, taking care of their patients. Because I will tell you, hands down, all my doctors, nurse practitioners, PAs, all they want to do is take care of patients. That's what they went to school for. That was their calling. Nobody said, I want to be a doctor, but I really love the accounting side of medicine. Nobody. So if that annual struggle about numbers would stop, I think we would see job satisfaction improve. I think, do we have to work on prior auths and making these quality programs mean something? Absolutely. But I also think that, that overriding just struggle is a basic inflationary increase to these guys, similar to what hospitals get. And I think it would go a long way. So if that's the place they start, I think that would be wonderful.
All right. Well, Jeff Smith, I want to thank you so much for joining us today.
Absolutely. I appreciate the opportunity, chance to chat. I hope you come to Charlotte.
I sure plan to. Look forward to shaking your hand there. Hope this was a little less painful than your experience on Capitol Hill.
This was great. This was great. And I'll tell you, I sit in on a radio show every Tuesday morning, a local radio show. So it's given me a little experience behind the camera. So I love this. In retirement, I hope I have a radio show.
That is wonderful. That is wonderful. We'll keep that in our memory banks then for any time when that comes up down the road. So for now, I just want to thank you for the work you're doing at Piedmont and the work you're doing for MGMA as the incoming board chair. Thank you again.
Daniel, thank you.
All right. Well, everyone, we're going to have this with a lot of show notes and resources for you that you can click right through, learn more. You can read Jeff's full testimony on Congress. And so until then, thank you all for being MGMA podcast listeners.